It's very important to save limbs because it really impacts patients' quality of life. Major amputations have a huge burden on patient quality of life and their independence and mobility, and so we try to save limbs as often as possible. Unfortunately, the results with limb salvage are very variable depending on the extent of wounds when patients present. There is the Society for Vascular Surgery has a wound, ischemia, and foot infection score, or the Wi-Fi score, which is used to provide a prognosis to patients about the risk of major amputation at 1 year. Wi-Fi stage 4 limbs, which is the worst stage, has a risk of major amputation between 30 to 50% at 1 year in normal settings. At Johns Hopkins Hospital, we've implemented a multidisciplinary limb preservation team that specializes in diabetic foot care. Our team consists of vascular surgeons, a surgical podiatrist, an endocrinologist, a dedicated wound care nurse, and a dedicated physician assistant. We also use consultants from infectious disease, orthopedics, and prosthetics as needed for individual patient cases. We believe that a multidisciplinary team is extremely important because these patients are incredibly complex and have multifaceted issues in their care that need to be addressed by various specialties. By having our multidisciplinary team, patients come and see all those specialties at one single clinic visit, so they're not required to transport back and forth to the hospital multiple times a week in order to get their care. We've seen excellent results with the implementation of our team. We've been running this team since 2012, and our limb salvage rates are 95% at 1 year, including for stage 4 Wi-Fi wounds. So we have seen better results than we would normally anticipate in these patients, but we do believe it comes due to the dedication of the team, both on the patient level and on the provider level. So one of the most important things about improved limb salvage is dedicated and regular wound care and adaptive wound care that changes as the wound changes. So wounds change on a weekly or bi-weekly basis, and if patients are only seen every month or 2 months, you're just not keeping up with those wounds. We see the patients every week when they're in their active wound stage, and we're able to change the wound care recommendations as needed and help with offloading so we prevent ulcer recurrence and also address any ongoing infectious issues that may arise.